Oop. I think we're live. I have no idea why my camera just went out. Give me a second. But welcome, everybody. We are here. He's sharing a window. Give me a second. Stop sharing that window. Turn my camera back on. Don't know how the fuck that happened. I must have bumped something. So we are live here. I'm here with Culture Catz, also known as Al. And we are going to have a lively discussion about the COVID pandemic response, basically. So for those of you that watch me all the time, I have desperately tried to get somebody to come on here with an opposing view of me. I did one time, and then they ran like a coward because I was going to go produce the document that would, basically end their whole argument. But Al has stepped up. I don't know if we're just from us talking in the green room, I don't know if we're going to disagree on that much, maybe a few things. But watch for the lasers. I don't get it. And by the way, I'm going to be turning, just so everybody knows, I wanted to say this, I'm going to be turning the chats off on my end. So I'm not going to see you commenting because my ADHD will get me distracted, and I don't want that for this conversation. So, Al, you want to introduce yourself?
Yeah. So my name is Al. I live in the UK. I taught science in high school which for us in the UK is like 11-year-old to 18. I don't know what that is, what high school is in America. So yeah, taught science in high school for about 20 years. I still work in education. I've had a few YouTube channels. I've given some away. I've come back. I've taken time off. YouTube's like a hobby. So I'm currently at Culture Catz. But that's basically, I'm just a normal guy with a normal, boring life.
And please do go follow him, by the way. Make sure you absolutely go follow him. And we thought we'd just state our points different by different. And so you have your stuff up. Okay, you were able to get that on there. If you aren't able to pull it up on the stage, let me know, because sometimes they won't do that for the guests. Let's see if you can real quick.
No, I can't. You're gonna have to do it.
Okay, so just let me know when you want it, and then you'll just switch the page whenever you want. Okay.
Brilliant. Yeah.
But we decided that we're going to give each other five minutes or so. Like, you don't have to use all 5 minutes, but we're going to give each other 5 minutes or so to kind of state our cases. And the idea behind this is we're just kind of debating. And by the way, in our conversation earlier, once again, ADHD, you said you didn't want to talk about the vaccine. If you want to bring it up, that's fine. I don't worry about YouTube that way. I mean, YouTube is going to do to me what they're going to do to me. I don't think they can do anything more to me than what they've done in the last 5 or 6 years. So. But I'll let you take it for the next 5 minutes or so.
Legend. Okay, so I think it's important to just get what my viewpoint. I know there's a lot of strong feelings here, and let's be clear. Okay, the lockdown that I'm here to support caused a lot of harm to a lot of people. People I know lost businesses. People I know suffered mental health issues. I know that it was devastating for a lot of people. I also know people who lost loved ones in the pandemic, far too young as well. People on both sides, really, really suffered. So, I'm not here to shout, "Yeah, you locked down" or whatever. I just want to have like a nice, friendly chat with Alan, bearing in mind that all the people who are watching have got like a feelings are going to be strong. But anyway, having said that, let me give you my opinion. Every now and then, you can be sat home, you can be nice and happy, and then someone will walk into your house and take a shit all over your front room, and you've got to clean it up. And whatever you do to clean that shit up, sorry, am I okay swearing, Alan? Yeah, okay. So to clean that shit, there's no right, wrong way. It's going to get messy. It's going to get stinky, and that is what the pandemic was. What we can see on screen here, if we can just bring that up, please, Alan. Is some data from, I've just pulled, this is from Our World in Data, and I've pulled out a few different slides from different dates going back from July the 21st to the 23rd to November 25th. And we can have a look at deaths per, I think this was deaths per million or 100,000. Yeah, deaths per million. And we can see some interesting trends. We can see the United Kingdom and the United States, so our respective countries, are doing pretty poorly compared to some of the other ones here. There's some interesting ones. I'm sure you might want to talk about Sweden at some point, but I really want to focus on these two down here for a reason. If we look at New Zealand and South Korea, they seem to absolutely boss it. The magical thing about South Korea is it didn't have a lockdown. South Korea had no lockdown at all, and it had an absolutely fantastic COVID response, protecting the economy and also protecting a lot of lives. New Zealand, they only had 10 weeks of lockdown spread over 18 months, almost like minimal lockdown. And I know New Zealand is an island, all right, and it's sparsely populated, but they also did really, really well. So why did they do well and we didn't do well? Well, the reason is they attacked early. Right, they were ready, they were prepared. While in the UK, we have Boris Johnson, and if you're from America and you're not aware of this, he was telling people to sing happy birthday while they wash their hands. That was his strategy, hoping for herd immunity as it ripped through the country. The United States, you were very, very slow also to react. We both did very, very poorly. And that is what put us in an awful position. Now, I've got a couple of papers here. That's just my little prompt. Like this one here, again, just saying that the mortality rate in South Korea was 5 times lower than the United States, and they didn't lock down. They didn't lock down in South Korea. Why should it be 5 times lower? If we look at New Zealand, we can see they did such a great job of meeting everything head on, keeping the response really quick, really snappy. They don't, like I said, they only had 10 weeks of lockdown, but what they did is they attacked it early. 28 days after the first case confirmed, they locked down. The testing was harsh and they really went at it. And the lockdown period was minimal. And you can see that they didn't start to actually get deaths really until the vaccine was out. And there's not a link there. What I mean is they started to allow the influx of COVID into the population. And the reason the deaths were so low, as we can see here, is because it managed to get some kind of immunity from the vaccine. So what the nuance is for me isn't the fact that, oh, should we have a lockdown or should we not? It's the fact that America and the UK fucked themselves by being so slow to react when they could have been learning from, the 2015 MERS outbreak, for example, in South Korea. They should have known, like South Korea did, that you should take these things seriously. And if they'd have acted earlier and they'd have acted more firmly, we wouldn't have been in the position where we're in here. Okay, but we were. Right. This is data from the UK. This is the last thing I'll say, Alan. I'm probably up to my 5 minutes. I've got data for the US, but obviously you're in lots of different states and it's all over the place. It's difficult. But from the UK, Alan's got a saying, and I like it. He says, reality exists, right? And I like the saying because it means you've got to view things through a lens of how the world actually is, not how you want it to be. So if you were in charge of a population trying to keep everybody healthy and you realize that you fucked up because you didn't act early enough, and you're looking at countries like South Korea that did act early and that did get their shit together, right? And we can see the cases, hospitalizations increasing exponentially. When you get to about here, you've got a decision to make. And what I think is the reason I'm going to say that it's justified to have the lockdowns that the US and the UK did isn't because they were acting brilliantly. It's because they were so incompetent to start with that they got themselves in a position where they were staring down a barrel of these exponential rises. And obviously, you can see the effect the lockdown has in reducing hospitalizations. That's from the World in Data. So I'm not here to say, brilliant, they did a great job. I'm here to say they fucked it up completely to start with, and they left themselves in a position where the lockdowns were inevitable. I've got a lot more to say, but I've got a feeling I've gone over 5 minutes, Alan, so I'll end it there. You're muted. You mute. No, can't hear you. Muted.
I'm having all sorts of issues. You can hear me now, right?
Got you.
Okay, good. Thank you very much. I appreciate that. So just real quick, we're going to go over here. So my biggest premise, and I'll pull these up here in a second. Biggest premise I want to get out to everybody is, first of all, COVID was not a population level threat. Therefore, lockdowns are actually not the way to go. When you look at outbreak policy and everything like that, you literally want the unhealthy people to stay kind of by choice, of course. And normally the very high risk group for the people that were in danger of COVID, super elderly people and fat people, The fat people don't get around as much, and the super elderly people are normally infirmed. So the average death from COVID, which was massively inflated, as admitted by just about every health official, because they included people that were even suspected of having COVID. We have people on our logs that died in car accidents and gunshots that they logged as a COVID death. But anyway, um, to lock up healthy people makes them less healthy. We're actually working against public health at that point in time. According to Dr. Johnny Anitis, which this paper is published on the World Health Organization, the infection fatality rate for under the age of 70 for COVID-19, the original strain, was 0.05. That is less than a seasonal flu for people under 70, and therefore that is not justified to do anything. There was never truly a global threat or population level threat, so therefore it doesn't even classify as a pandemic until they changed the definition. Now, I thought you had some really good points about like the different countries and why they fared differently. One of the biggest reasons is South Korea does not have a lot of fat people. They just really don't. And if you look at the two high risk factors, age and obesity, elderly people did not fare well in the United States, especially because we threw infected people into nursing homes for the first time ever, which was a crazy policy. But then secondly, if you take a look at when COVID actually started, you can take a look right here. Give me 1 second. I got to find it again. I've just got all sorts of stuff all over my desktop. Here we go. So this is the serological testing for December 2019 and January 2020 through January 2020 of antibodies and blood donations throughout the U.S. So of 7,389 samples, 106 were reactive. Of these 106 specimens, 90 were available for retesting. So, I mean, they did not just test it once, they tested it again, as science should be done. 84 of the 90 had neutralized activity, meaning that they had COVID antibodies. So that means in 9 states, separated by thousands of miles, all the way across the United States, there was already 84 cases of just the people that donated blood. By the way, that is 1.2%. So 1.2% of the population of America, by the way, would be millions of people already infected, likely by December 13th of 2019. Now, if you extrapolate that back through how long it takes for antibodies to develop and how long it takes for the infection, which, by the way, the infection for COVID-19 is anywhere from 4 to 7 days now that they found out. So the 2 weeks to slow the spread was ridiculous to begin with. But so if you extrapolate that back, thousands of miles apart means different entry points. So now it is spreading globally well earlier than what they thought it was. So that means if you extrapolate back at least 3 cases worth, so the people that donated blood that had antibodies in their system on December 13th of 2019, proven by double testing, if you go backwards, they probably got COVID about 3 to 4 weeks before that. And then they got it, the people that gave it to them got it from somebody. So now we're looking at late September, early October for the actual spread of COVID throughout the world. So I also wanted to point out the waves that you saw, and I'm probably about done with my time too. But I wanted to point out the waves of things that that you showed, like the waves, the peaks of cases, which cases are hilarious because we use a PCR test. But if you look at the waves, that's very typical because it's a thing called Farr's law. Farr's law is a mathematical equation that talks about pandemics and how they normally start at a very high peak and then they go down and down and down as you reach herd immunity. So the first wave was actually in the fall, winter of 2019. Completely unnoticed by the entire fucking world. We were not afraid of COVID until they told us to be afraid of COVID. And it was never a population level threat. Therefore, lockdowns only caused more harm than good. With a 0.05 infection fatality rate for people under 70, especially when you get into younger people, under the age of 50, it is insanely low. Under the age of 20, there's almost no risk. To lock people down, especially when you're saying that they might have it and not know it and give it to other people, which means asymptomatic spread, which before the vaccine was never even an actual thing, admitted by the WHO, and then they walked it back. COVID just wasn't justified. The lockdowns, the masks, the measures we took was just not justified, in my opinion, of course. You're up. We can go ahead.
Brilliant. You said about 3 or 4 things that I'd really like to respond to. I'll try and keep them as quick as I can, if I'm all right, just to bounce one to the next. So yeah, if you saw me making some notes, I wasn't doodling. I'll just throw it all at you in one go, and then you can tell me what you think, if that's okay. So I'll go backwards. You talked about waves. Can I share a screen again, please? Is that okay?
Sure. Yeah.
So you talked about waves and the cases, and I know I've heard you talk about Farr's law before. I probably pronounced that wrong, but I know what you mean.
No, it's Farr's law. You got it right.
These weren't cases. These were actual hospitalizations, and these arrows that I've got placed here are the actual dates in the UK where we locked down. Our 2 big lockdowns. We had a mini lockdown also here. So if I actually and I'm not just making that up as bullshit. You can Google these dates. These are the dates where we locked down. So if this is just a case of a natural pandemic wave, then it's awfully, to me, significant that the lockdown came about 2 weeks, which you'd expect, before hospitalizations dropped on all 3. So I don't think that's natural. I think that is the lockdown. Obviously, so go on.
Farr's law looks exactly like that. I mean, it happens whether you're locked down or not. Like, the reality, lockdowns are not. First of all, there's a difference between cases, hospitalizations, and death, right? And it depends on how we're also. I want to make sure, how are we counting a COVID hospitalization? Is it anybody that proved positive for COVID, or is it just counted as they're in the hospital with COVID? That sort of thing. I mean, because very frankly, when there's lockdowns, hospitals weren't even open necessarily for anybody to go in otherwise. But when hospitals were open and there was no lockdown, they would test everybody to see if they had it. And anybody that even proved a little bit of positive, even if they were there for a severed arm, was listed as a COVID hospitalization. So the noise in the numbers also is a big thing we should talk about too.
Definitely. To answer that, this is like UK data. Like, I have got data for America, but it's so complicated with all the different states and stuff. So just the simplicity to make the point about lockdowns, I'm using the UK stuff. This is admissions for COVID. But to me, all right, I get it. You disagree. You think this is natural, but to me, this is massively significant that we've got a lockdown here, a lockdown here, a lockdown here, and in each case, 2 weeks afterwards, we see a huge drop in hospitalizations. To me, that's too much of a coincidence. I mean, you can argue here, we know we get waves. We know we get that. But this was an actual national lockdown. This was an actual national lockdown. This was an actual national lockdown. And each one, 2 weeks later, we're getting a decrease. This was only a very short one before Christmas. Just a few days, that one. And these were the 2 significant ones. But that's just my, I know you disagree, but we'll put it out there.
It's not that I disagree necessarily, because if you have people not mingling, people are not going to be getting it. What I'm saying is it still wasn't justified, like, at all, like whatsoever. So you're going to hurt healthy young people to protect high risk people, right? Because can we agree that, like, locking somebody down is a form of punishment that we use for criminals too, right?
Like I say at the beginning, the effects of lockdown. I'm not here to trivialize that. Yeah, it's been people's mental health, people's businesses, people missing medical appointments that actually turned out they should have gone to because things have gone unnoticed. I understand it's affected a lot of people badly, so I'm not here to demean that. What I'm saying is, like you said before, reality is a thing, and when you're in that position and you're seeing. I'll just drag this on one more time. But when you're seeing these cases just go up and up and up and up and up exponentially, you've got to make a decision at some point to do something.
Well, the decision's already made because it's already going to reach its peak. It's not just going to keep going up. Farr's law will show you that every pandemic has peaks and valleys. It's not just going to keep going up. So if you lock down right before, like we locked down in March, the second wave was already peaking. It was already peaking. Like, I mean, the lockdowns didn't stop it. Like, that is the entire idea behind the mathematical principle of it. And I get what you're saying. I mean, we're still running under the assumption that our governments would have a right to, like your government does. Your government has a right to do that. Our government did not, and it was unconstitutional for them to do so. I get where you're coming from, where you think that it was effective. And the second one, like the one by Christmas, I mean, maybe people just went to the hospital less. And is it a COVID hospitalization for a guy in his 30s that, maybe had a bad cold? or is it like, grandma? And I will point out that that is still an extremely low number. The number of people that died the first year of COVID in the United States is under the number of people that die from medical error in the United States. Like 282,000 people died in the United States the first year. 371,000 die of medical error. So are we in a lockdown from the medical industry? Like that's the thing. Like, people die. It's unfortunate. The people that do the dying did the dying for COVID. Elderly people and fat people. The number of people that died under the age of 20 should tell you that we should have never locked down, ever. It hurt them more than it helped them. We in the United States gained an average of 35 pounds during the first lockdown. In the United States, an average of 35 pounds. That pushes almost everybody into morbid obesity, which, crazy enough, pushes them into the high-risk group for a cold. And I get where you're coming from. Like, you're talking about, like, you think it might have helped. I'm saying that natural selection should naturally select too. I'm not saying that COVID wasn't a real thing. I'm saying that the massive overblow of what was done in its name is the problem.
Okay. So, I mean, we're going to use a lot of the same data. And we are going to have different opinions on it, but that's what this is about. It's for people watching to then decide, where to fall. So,
right.
We won't argue the toss over that. But I do want to go to this, if that's right, just to pick up something else you said. You brought up John Ioannidis. Am I pronouncing that right? Ioannidis? Okay.
Yeah.
Now, look, you're right. He was held up by the World Health Organization. He is. He's incredibly credible. Like, he's incredibly credible. If he says something, to me, I believe it. But I've got a paper here by Ioannidis, Professor John Ioannidis. And this was written just to give his opinion on the lockdowns. This was written during the first lockdown. Should governments continue to lock down? And in his words, so this is the guy who came up, and said that it's only as dead as the flu. In his own words, that lockdowns are blunt but necessary. They're a necessary tool. He goes on to say that you can't lift restrictions without the capacity already in place for, massive testing and contact tracing. And don't get me wrong, if you read this paper, he hates lockdowns. He hates them. He detests them. But, he understands that actually it's something that should have happened.
Well, no, it's his opinion.
It's his opinion.
The data shows that under the age of 70, the infection fatality rate is less than the flu. His opinion on whether that means we should lock down or not is an opinion. The data that he put out is that COVID, at the time they were leading with its 3.34 infection fatality rate, which, by the way, is 50% more deadly than the fucking Spanish flu. You had to be an idiot to believe that was true. People would have been falling over in the street, and nobody was except for the people in China that they published falling over in the street. So his opinion on whether we should lock down or not, like, maybe in Greece they would, because that's where he's from. But the data shows that under the age of 70, it was very, very, very mild. And that does not justify a population level threat. And a population level threat is even what's needed for the definition of pandemic before 2020. So my argument is, one of the things we brought up two things by Ioannidis. One is a study. Another one's an opinion.
So I get that. So, I mean, I think it's an opinion that is coming from a very educated viewpoint, from somebody that understands that the IFR is, I'm not going to argue with that. It is kind of like in line with flu, right? Maybe, yeah. It's for different age groups higher, for different age groups lower. But it's
so we're done then.
But
we're done. We don't lock down for the flu. We never did. So we're done then.
But obviously, the reproduction number is so much higher. And you brought up the last thing I wanted to address.
That's actually a good thing. Low infection fatality rate and higher R. That means that it spreads faster. As if we would have advised elderly people and super morbidly obese people to stay the fuck inside, and encouraged young people who are at almost no risk to mingle and develop natural immunity, it could have been over way easier. Dr. Butts, who was the former CDC director, the equivalent of CDC for the European Union, that he recommended that at the very beginning. We should lock down the nursing homes, pay the people double, triple overtime, make them rich to take care of these people, make it so they don't leave, have those people maybe stay inside as much as they want for a couple months, and then we let everybody else mingle, and we're at herd immunity, and that's how we've always done it. Especially for something, as you have conceded, is in line with the flu, because we've never locked down for the flu before. And I'm happy you have this chart back up, because once again, you're pointing out how these two countries, which are, by the way, two of the fattest Western countries in the world, had a harder time with it. And I'm still going to point out that those death numbers in a year, I mean, amongst our population, again, the average was 300,000 people per year were passing away, listed of having with COVID, not of it, with it. Our CDC director also said that only 5% of those people passed away of COVID. The rest had at least 4 other serious comorbidities, and the average age of 80. The average age was over the age of life expectancy in America, which means you were more likely to live longer if you got COVID than otherwise. And it's not, I mean, that's a trick of the numbers and everything like that. So I get where you're coming from, but we're done. Like, I mean, if it's in line with the flu, nothing was justified.
Well, I disagree with the point that you got where you think a bigger reproduction number is better. Let me just articulate my reasons for that. There's a couple. If we look here at the critical bed coverage for the United States, 0.31 per 1,000. Now, because the reproduction number is really high, you know, left unchecked, you are going to get thousands, millions of cases within a very, very short amount of time because it spread so rapidly. Now, if we have a look at a place, I just did some fag packet maths earlier on.
But just real quick though, it did spread for like a good 6-7 months in the United States, completely unchecked, and we didn't have deaths. We didn't have deaths until they told us people were going to die of it.
See, we said in the green room we'd have the same data and different conclusions. I actually brought that paper that you referenced, exactly the same one, because to me, this reaches a completely different conclusion. If you would have had an entire first wave go unnoticed and then sampled over 7,000 people, you're going to have more than 106 who are demonstrating that they've got antibodies.
Well, it's people that chose to donate blood, and that's still in the high percentage of it. It's still in the it's close to 1.4% or 1.3%. So 1.3% of the populations of those areas, I mean, we're talking tens of millions of people that had cases. I mean, that's reality. I mean, these are from California, Connecticut, Iowa, Massachusetts, Michigan, Oregon, Rhode Island, Washington, and Wisconsin. That is tens, if not 100 million people. So 1.4% is millions of cases. But is it people that we didn't notice, that we didn't even notice until we were told to notice?
But is it also not equally possible that these pockets of people in different places were the beginning of the introduction of the virus, where people had come, brought it from different countries or picked it up from people who, after they've been abroad? Is it not equally possible that these numbers also show because to me, it's perfectly possible that these numbers are showing the beginnings of not the end of a wave, but the beginnings of the introduction, which is what would fall in line with everything we've said. Like, what is it about those numbers that you think means that's impossible, or do you not think that's impossible?
Oh no, I mean that's when there was obviously a beginning, but if you really want to look at it, if we got more than just these states, because these are the only states that are tested. If you tested in every state, I'm sure you'd find more. Would you not? Or do you think it was just isolated to like Wisconsin is pretty isolated when it comes to the United States? It's not like a mecca of people traveling to for tourism. It is like basically cows and fields in Wisconsin. So if it reached there, which is not, again, a heavy travel area, there's no reason to believe that it would not be throughout the entire United States. Would you not agree?
I don't think if we're only sampling a couple of different states, a couple of different cities, I think it's impossible to tell. But to me, it looks, because if it is a case of, which I truly believe, that this data is absolutely representative of the beginnings of a pandemic, where people have come from abroad, landed in an area, or been abroad and come back and they've got it, and it's slowly starting to spread in their area, which is exactly what it fits in with the timeline that we would have expected. To me, this data fits exactly with what I would expect to see. Rather than the tail end of a pandemic. Oh
no, I'm not saying it's the tail end of a pandemic. I'm saying it's the beginning. I'm saying it's the start of a pandemic and in the wave. I'm just saying it went unmitigated throughout the entire United States, because these are only the states that are tested. And I'm going to point out one more time, because you don't understand our geography, Iowa and Wisconsin are fucking empty. Like, I mean, empty, right? So other people like Florida's not tested. Florida has how many international airports, how many cruise ports? Texas is not there. Texas has how many ports, how many major airports, how many major cities? Like, we're not seeing the entire data. So you're looking at 90. I'm looking at that going to be way higher than that. And I mean, way, way higher. It was rowing throughout the United States before then. We also, at the beginning, did not take any antibody tests of anybody. That, remember, they didn't even care if you had antibodies. You still had to lock down. Like, so I get what you're saying, but it was clearly freely roaming throughout the entire world for at least 6 months before anything was done about it at all. And then after 6 months, the United States counts every single case of anybody even suspected of having COVID that died in the hospital. And I'm talking gunshot wounds, car accident victims, all sorts of things. They count all of those as COVID deaths. And it still works out. It still works out to the average age is over 80 with 4 serious comorbidities. This was not a population level threat. And that's my point of the whole thing. If it was a population level threat, people would have started dying in droves from it. Like, out of those, notice how they didn't mention any deaths of those people, right? And again, those were just the 9 states that were tested. There's 41 others that are much more populated than most of those besides California. Like, that's my thing. Like, it was clearly going throughout the United States. We clearly did not even think about doing anything until we were told to, you know? Saying you had to be a special kind of stupid to believe that we caught the first case. We caught patient 0 in January in the United States. You know,
I don't think anyone's saying that. What I'm saying, I don't think that data represents, months of it being here. I think the more logical argument is people have brought it in, in numbers greater than 1. It's not just one person getting off a plane. But again,
right. Well, it was here for months. I mean, that's not arguable. It's thousands of miles of distance between those geographic states. It is easily seen as those people caught it from somebody who caught it from somebody. That puts it at the very, very, very latest early November. It was months. It was easily months.
How do you know it's been he caught it from someone who caught it from someone who and how do you know it's not landed, and just been maybe one transmission or something? How do you know it's been a series of transmissions?
Thousands of, like, I get it, you're in the UK, but do you know the distance between Rhode Island and California? These people aren't bumping into each other. Okay, it's thousands and thousands of miles. But that means there was multiple key points of entry. Multiple key points of entry, absolutely. So one way or the other, the early date they put is January. But we know it was at least a month before that. At least, right? Because that's when 90 people from across the United States, like, are you saying that all these 90 people traveled abroad, caught COVID, came in, and then donated blood? Because that seems awfully unlikely to me. What it seems very likely to me is these people had antibodies in their system because they caught it from somebody else, and it's almost incredibly likely that those people also caught it from somebody else who may have been the person that brought it into the United States in that area. But to even think that it's at least months, it's at least early November. I could make an argument for mid-September, but it's at least early November at the very least, and that's months. I mean,
I think the reason I brought that is because I did hear you say September once, and I think that's what I was arguing with. Now, if obviously they're not going to be, like you say, the patient 0 in America, and there will have been a little bit of history behind it. So I'm more, you detect your first proper cases in January or whatever. Of course, it's been there maybe a week or 2 or something before. There is that leeway. And if you're going to say, well, you reckon maybe end of November, something like that, I'll go with that.
Early November at best. Early November at best.
My problem was September, because I heard you say that. I think I heard you say that on a stream. Maybe you didn't.
I said I could make an argument for it. Absolutely, and I absolutely could. Yeah, I absolutely could.
Well, that's why.
And here's the thing, and here's why I revised that. Just real quick, I revised that because the revised incubation period for COVID went from 14 days to 7 days, and that means that has to be revised. That's why I revised it. Like. They remember they told you need at least 14 days, and then all of a sudden now it's like, well, it's 7 days. So, I mean, just another piece of bullshit they gave to us.
Well, you learn. I think it's like you're learning all the time, aren't you? At the beginning of a pandemic, you are learning in your any kind of new disease. You don't know everything. You're gathering data as you go along, and you're refining and improving. So, a lot of things were said, a lot of things were changed, a lot of things were made a little bit more refined. But that's what the process. You've got to expect that, haven't you, with something new that you're going to gather data and improve your understanding.
No, you wouldn't expect what was done, because working in healthcare, I can tell you that locking down people is idiotic. Like first of all, it's incredibly mentally unhealthy. The people should go to jail for the amount of suicides. The motherfucker you have up on this fucking screen should already be on death row. He killed tens of thousands of elderly people, tens of thousands.
Was he the one that put the patients into the old people's home? Yeah, well, I agree with that. That was a dumb move.
Him and a few others. So they rewrote a lot of things. They basically rewrote the policy on that, because as a hospital administrator, if you were to admit, as a skilled nursing administrator, if you were to admit a patient positive with a pathogen that was dangerous to your senses, you went to jail. They made it policy to do so. But also, I mean, I get what you're saying. I do. But real quick, back to the early November. That is the mathematical date. Like, I mean, it's hard to argue against it. Like, it really is. Like, for your argument, we would have to say that 90 different people came in the United States all at the same time and then donated blood. And it happened to be that we caught them, right? Like, because that's the thing. One more time, it is just from 9 states and just 7,000 samples. There's 330 million people in the United States, or probably 350, because we don't know how many illegals we have. So it's, I get what you're saying, but it was easily spreading very readily at the latest early November.
I mean, when I put that resource together, it's because, like I said, I heard you say on a stream September, or you could make a case for September or whatever, which would imply that by then the wave would have hit, an awful lot of people. And right. I just didn't think that. But yeah, if you're going to obviously,
just honestly, it could still could have hit awful lot of people, because it's a fucking cold and not deadly, and a lot of people didn't even go get tested. So
something I want to ask about. In fact, no, we'll leave that for now, because I know we're only here for about an hour. But you mentioned before about protective shielding, I suppose, is what you were talking about. Get the what you would have done is you'd have protected the elderly, you'd have protected the vulnerable, and just let everyone else get on with the business.
I would have suggested that they take protections. I wouldn't force anybody to do anything.
Okay. So, I mean, the closest country that came to doing that, and like you say, reality is a thing. We actually have we've got the opportunity now where we can look back and see how that panned out in reality.
We kind of do. It depends on how you counted COVID cases too. So,
well, if you look at Sweden, what Sweden did, and this is my bugbear. This is why when I was looking here earlier on, and I was saying something's got to happen when we're seeing these huge peaks. I look at Sweden and people say, yeah, well, Sweden did all right by the end. They did all right, yeah, by the end. But what they did, the people that they should have been protecting in Sweden, in the care homes, nearly half of the deaths happened in the care homes, which means they weren't fucking protecting them. Like, if you can't say that you were protecting people if half the people you were protecting die within the first couple of months. So my question to you would be, like, given the fact that Sweden didn't do it on a national level, how do you go about making that work? How do you go about protecting those vulnerable people without them being wiped out within a couple of months like they were in Sweden? Like logistically, how do you do it?
Well, I'd first like to thank you for proving my point that COVID was not that deadly of a disease for younger people, because, as you said, most of their deaths were in the elderly people, and that means that they just let it, them not locking down was justified. But secondly, I would have, because I used to run nursing homes. Mm-hmm. I would suggest to any people like that were coming in, if you even think you're sick, stay out. Because here's the thing: asymptomatic spread is not a thing. If you're not symptomatic, you're not contagious. So if you think you're sick, if you have the sniffles at all, I would even go as far as for the nursing homes of taking people's temperature, like taking people's forehead temperature and being like, hey, you've got a temperature. It's in our charter that we can't allow anybody in that we know might have an illness. But besides that, if the elderly person wanted to go out, they're a fucking free human being, and they should be allowed to go out and assess their own risk. We would, of course, say, hey, there's a new cold that you're at high risk for, and if they still wanted to go, they could go. Do you know how many people in those nursing homes probably died of loneliness? I mean, like literally loneliness, like because that's an actual thing that happens in nursing homes. Like with people dying without being able to see their families, those sorts of things, that was horrific. Now you're asking how I protect those people. I would have given them choice. That's how I would protect them.
They didn't lock down in Sweden. So they weren't dying from loneliness because they weren't locked down. This is what I mean. They tried to protect them in a different way.
So the people that normally die of new pathogens were dying of new pathogen.
So they weren't being protected.
It is what it is. Like people die. Elderly people die. The average age in Sweden was still over 80 of people that died of COVID.
But what about? So my point is this, right? Let's see if I can articulate this. We know that they were elderly and we know that they were vulnerable. Okay, we're not arguing with any of that. But if we look at it at a human level, right, they had the bulk of their deaths very, very, very early on. And you think about the families and you think about, the kids and the grandparents and those elderly parents, those years of life that were lost, that those grandkids in those formative years will have missed out on the grandparents, because what Sweden basically said is, listen, we're not going to do anything too drastic. Fuck the old people in the whole homes. They can die first. And that's literally what happened. Like, to me, that's just immoral.
It's what happened here. It's what happened in the UK. Elderly people died. Elderly people died in way more prominence. I mean, look, the UK had lockdowns. Elderly people still died in prominence. The United States had lockdowns. Elderly people still died in prominence because elderly people are the people that do the fucking dying for a new disease.
But did they all die in the very first kind of, the very first instance? Did they die so early on? Was it almost like a sacrifice, like it was in Sweden?
It's semantics. I mean,
isn't it
that is
like
honestly.
A year with your grandpa?
Yeah, it is. That is. It's.
I think that's where we differ. That is definitely where we differ.
That is where we differ, because I worked in healthcare. Elderly people die, like it happens. Do you know that I've seen an elderly person die of hiccups? I mean, and I'm not joking. So I get where you're coming from. You're thinking that something should have been done. Would you prefer we just lock them down? Because we could, I mean, that was the only other alternative, is that we eliminate any contact from them. And it doesn't look like that they fared any differently than the United States or the UK. It really doesn't. So
when you look at
least these people were able to see their family members before they died.
Well, for the few weeks they were around. But the reason I've got this up is because when we're comparing countries, you obviously know the effect of climate and culture on the spread of these diseases. Even that John Ioannidis paper has different IFR rates for different places. So if we're going to compare Sweden, we've got to compare Sweden with its neighbours, right, which are Finland and Denmark. And it was by far the worst. This is 2025, still by far the worst compared to Finland and Denmark. But again, what hits me is that these deaths were all really early doors. Finland, that they, like, the years of life lost, is that not important to you? Years of life. The years of life lost for an 80-year-old versus the years of life lost for a 12-year-old that all of a sudden doesn't gain 30 pounds and stuff like that. Like, if suicides increased by even 5% among young people, those are more lives lost from lockdowns than were lost from 80-year-olds dying. So it's a trade-off. Is it? I mean, I know. I think just
it's natural selection.
Just our principles are very different.
Yeah, of course they are. Yeah, and you're allowed to have your principles, but this is natural. How do you justify destroying people's lives for basically trying to protect elderly people who could choose to stay in themselves? Like, elderly people could choose to lock themselves in a room and be taken care of. They could choose that. Absolutely. That is provided at any nursing home. Any nursing home that's provided. So why take the choice away from everybody when elderly people, morbidly obese people, people with high comorbidities could choose to stay home? Nobody was forcing these people to go out. Shit, in America, you can have groceries delivered to your house. You don't need to go anywhere. If you're afraid of a fucking cold, you could stay in. But it should not impact the other people who want to accept risk of going outside. So I understand where you're coming from, but natural selection is not going to naturally select no matter what.
Well, the reason I think that, and I'll bring you back to this. let's just imagine we are back here like 20th of March in the UK, and again, I'm using the UK because that's the data I've got on here. If this lockdown didn't happen, genuinely 100%, what do you believe this curve would have been exactly the same as it is now, or do you think it would have exponentially risen if that lockdown didn't happen?
I believe if you look at other countries who didn't lock down, I believe it would have been about the same. I don't think it would have exponentially gone up.
And you don't think it's a coincidence in any way, shape, or form that 2 weeks after each of these events, 2 weeks or the same time frame, we get drops in hospitalizations? Are you saying you think that's a coincidence?
Well, maybe not a coincidence. I mean, could it have something to do with it? It depends on the severity of the lockdown, because if you are just actually making so it's people who are in prison and you're arresting them on the beach or they can't go anywhere, of course there's going to be less spread because there's less people going around. I'm also saying that hospitalizations don't mean deaths. And I'm also, again, saying that the deaths were super fucking low. 271,000 people in 2020 for the United States, that's super fucking low. Like super fucking low. Again, one more time, more people die of medical error in the United States than that. Way more. And you want to pull up New Zealand and South Korea. I'm going to state one more time that their obesity population, the people that have comorbidities, is very drastically different from both UK and the United States. In the UK and the United States, in the United States, about 60% of people have at least one comorbidity. That's on them. That's natural fucking selection. I will still point out that even though 60% of people have at least one comorbidity, that the infection fatality rate under the age of 70 was still 0.05. If you were healthy, it was like 0.01. So why would we not just encourage, if we're going to encourage anything, if we're going to do anything, why, instead of mandating you stay inside and we close businesses, why don't we mandate people lose weight? Because
I'm with you on that. Yeah. People should be encouraged to be more healthy. But I think we hit
what do you think? What, and an honest question: what number of deaths would be justified in destroying the economy, locking people down, increasing suicides, making learning almost impossible for young children, making it so people got arrested on the beach for fucking jogging, tried to fucking in some way say that putting a cloth on your fucking face stops a virus that travels on aerosolized vapor when you can smell through the fucking piece of cloth. Like, all of these things were idiotic. Like, I mean, and again, none were ever done for anything. Do we do it for MERS? No. No, and MERS is actually deadly. Did we do it for SARS-1, which had an infection fatality rate of literally something like 1.5%? No, we didn't do it for that either, because we wouldn't do it because they're ineffective. The lockdowns have been shown to be way more damaging than what they're worth. The world lost 25 fucking trillion dollars or something like that in the economy. People are still recovering. Like, I get it that nobody wants anybody to die, but natural selection naturally selects people. People fucking die. And again, one more time for COVID, the people that were going to do the dying of new cold did the dying in predominance: elderly people and serious comorbidity people. This was nothing new. This was a flu season with a fantastic marketing department.
Let's put some numbers on that then, using John Ioannidis' paper. And I think we don't need to pull it up because I think we both agree on the data that he brought. And I think you said to me, let's use the IFR for young, healthy people, right, that don't have comorbidities. And I think, off memory, it was 0.05%.
No, that's people under 70.
That's people under 70 who were fit and healthy.
No, that's people under 70, period.
That's people under 70 fit. Okay. So what was it for those that were like really fit, or did he not break it down to fit and healthy? Is that the best we're going to get?
That's the best you're going to get from his study. But if you extrapolate down where, being healthy, getting proper vitamin D, hydration, or like that, you can make an argument for it being anywhere from 0.02 to 0.01.
Well, let's go with under 70.
And that's for healthy people under 70. If you get down into under 30, I mean, it's in 0.0003 area.
Well, let's go with 0.05 and people under 70, right? So we take New York, which has a population of about 8 million. And if we imagine for every population of 8 million that gets infected, and we know that the reproduction number of this virus is really big, and it's going to hit populations of that size, that equals 4,000 people for every population the size of New York, 4,000 deaths.
Well, no, that's if they get infected and they don't have T cell immunity, because T cell immunity was a huge factor for most people. About 80%, but a good 30 or 40% of people probably had T cell immunity from COVID, which means, for those that don't know, T cell immunity is the immunity you get when you get a like virus. And seeing as how COVID is similar in 80% to coronaviruses, so not all those 8 million people are going to catch that. Likely, very honestly, maybe 50% of people are going to catch that. So if 50% of people catch it, now we're looking at 2,000 people, right? 2,000 people extrapolated from eight people. So there's 340 million divided by 8 million. That is, a couple 100,000 people. We don't stop people from gorging their fucking faces, and obesity kills about 500,000 people a year in America.
It does, and alcoholism does, and depression, and lots of things do. And the thing is, you spend your time, and this is where I'm struggling to see if I can articulate this properly, because this is where I'm struggling to marry what you do normally and this. You spend a lot of your time helping people lose weight so they can live longer, they can live a better life. You obviously care about people's health
because they choose to.
Right. Okay. So the people, these people under 70 that would have caught it and died, these, couple of thousand people per 8 million, or these, however many we extrapolated up to, like, I'm struggling to see how you don't have the same, they're not choosing to get the virus and die, but yet we can slow it down.
Yeah, they are. By going outside, they are.
So you do want to do a lockdown?
No, you can choose to lock down. You can choose to lock yourself down. Lockdown. Nobody should be locked down. You can choose to self-isolate. They can have chose to stay home if they were afraid.
The issue is that it was made mandatory.
Why should I have to stay home because you're afraid?
So the issue is it was mandatory in the US. Is that the fact that it's not the practice, it's that it was just mandatory, and it was a case of like, well, these are my rights, and
people should be able to accept their own risk. Absolutely, yeah.
But let me put this another way. If I went to the pictures, or you went to the pictures, I'm sure you don't take any mess, and you go there and there's some twat in the corner talking and playing his banjo while you're trying to watch a film, right? I mean, he's got a right to talk and play the banjo, but there is a social expectation. I bet you'd be the first one in the pictures to stand up and say, "What the fuck are you doing?" We're all trying to watch the film. You've got no consideration for other people. To me, this is on a bigger scale.
That's a serious conflation of argument right there. It's wild. So here's my thing. I could also then choose to leave.
Mm-hmm.
Could I not?
Right? Would you?
Probably.
Or would you put your expectation?
Probably. It's not worth. It's not worth getting into an argument and possibly having to shoot somebody. So I would probably leave. You know what I mean? Like, my thing is that's not risk to me. Like, I should be able to, like, you're conflating like an annoyance with actual risk. If you are afraid of a cold, you can feel free to stay in. If me possibly having that cold and being out makes you afraid, stay the fuck away from me. That's your choice. It's my choice. Just because you're afraid I might have a cold doesn't mean that I should have to not go outside because of you, right? It's very different between like what you brought up, because what you brought up is an inconvenience. We're talking about different freedoms here. And I'm saying very clearly, I'm not for lockdowns. If you wanted to self-isolate, and I said this the entire time, if you wanted to self-isolate, self-isolate. As a matter of fact, I told my parents that they should self-isolate. They're both 80 and have comorbidities. So I told them they should stay home. Because I understand, and I tell them to stay home when there's a bad flu season. I've told them for years, because I understand they're frail because they're elderly. My parents are the people that do the dying from colds. But that doesn't mean that I should have to fucking stay in.
I think my issue, I'll end on this, and then I do want, because I know you said you only want to go for an hour. I do want to ask you about the PCR comment you made earlier on, but dead quickly. I think the point I was trying to get across is with the cinema thing. We do walk around in everyday life that there is an expectation, because we live in society, that people will recognize that and behave in a certain way.
And so if you're afraid, you should behave by staying home.
And if you were in charge, let me just put this way: if you were in charge of a population of 8 million people, you're in charge of that, and the deaths in that population ultimately get pinned at your feet. And this is what I was getting at when I was talking about this earlier on. Okay, you're in charge. You are here. You're seeing the cases rise. It's going to get pinned. So this is your decision now. Any deaths here are going to get pinned at your feet.
Yeah.
How would you look after that population the best while making sure least people die?
What? No, I would make sure that they felt free. I would educate them as much as possible and say, hey, if you're high risk, you should probably stay home. But I would realize that I'm in charge of a population. I'm not their ruler. I'm not their dictator. I can't tell them that they're free or not. I would tell them all the information, which I've said from the very beginning. We should educate these people like, hey, maybe if you're fat, you should lose weight. Maybe if you're elderly, you should stay in. I've said this the entire time. But to think that we should dictate to people, like, the difference, and the differences might be a cultural thing. You guys have monarchs. We have a constitutional republic. Like, our government should never be able to tell us to do any fucking thing like that. So I understand where we might have a little bit of cultural difference, but if I was in charge of an 8 million population people in the United States, I'd be like, hey, everybody, I'm doing my duty to you as your elected representative to tell you that there is a new pathogen out. It is highly predominantly risky for elderly people and people with multiple comorbidities. If you have those, you should likely limit your contact, stay in. You are free to do what you want to do. And for younger people, I would give them the absolute number that we already knew early in the pandemic, that for our people under 70, it was basically a flu. That's what I would do.
Our difference
and if they're upset with me for it, okay. But I would have known at least I didn't take their freedom away from them to choose their own risk, like actual fucking adult human beings.
So on the whole, then, our differences are not scientific or data-based. They are on how far
the data. The data is the data.
If we can talk, I know you normally stream for an hour, and you said to me just an hour.
Keep going. We're good.
You said something about PCR earlier on. And I just wondered, you said, well, the PCR is, can you just expand on why you think the PCR tests somehow were overinflating?
Well, they were running them at 48 cycles. You can find anything in anybody at 48 cycles. I mean, a new paper just came out that showed that like 83% of them were false positive anyway. Right?
I'm sure a paper did, but I've got to not believe that's credible. Okay. So here we have.
Why is that? Because it goes against the narrative, right?
No, because it goes against that. Because I've seen so many papers saying come out from people that when we look at the other things they've said, the same balmy thing. They're associating with flat earthers or the creation.
Explain what 48 cycles means.
Yeah, I'm going to do it now. And this is where I think our confusion is. So this is real-time PCR. And I've got a bit of a bug in my bonnet where people say PCR can be used at too many cycles, because it cannot, absolutely cannot. So let me explain how it works. You set your PCR up, and you set it up for however many cycles you want to set it up for, 40, 50, 60, 80, a million. Not that you'd ever go that far. So let's say that is how far you set it up for. Then this red line here, as the genetic material is going through the cycles, it releases a fluorescence into the container, which builds up. And when that fluorescence gets past a threshold level, which basically means it's above background noise, we say that is the cycle threshold. The cycle threshold. Now, the cycle threshold here is about 18, but the machine was set to run for 50 cycles. Nobody gives a shit that the machine is set to run for 50 cycles, because all that's important is the cycle threshold. That is the result, and that's what you use to calculate back how much genetic material there was in the cycle. So when people say you can run PCR for too many cycles, no, you can't. It's like saying
the creator of the PCR test who said that was wrong.
No, right. So let's have a look at the patents, because this is a book. This is a lot of misinformation. I'm not saying you're doing it deliberately. It's out there, and I really want to address this. Okay.
Well, before we even get to that, I'll say this. So what if you're fucking positive? If you're not symptomatic, it doesn't fucking matter.
But the point of this was, we've got to educate the people out there, and this PCR misinformation is huge. And maybe you disagree with me when I've explained it, but I think if we can get the explanation out there, because it is important.
Well, are you saying that a positive PCR test means that you definitely have COVID and are definitely symptomatic and definitely are going to be spreading it to people? Yes or no?
I want to get to that. It means you've definitely got the genetic material inside you.
Right, but that doesn't mean you even have the virus. It just means you have the genetic material, right?
Right. But if I'm going to probably
Right.
need about 2 or 3 minutes. Is that all right to get through?
Yeah.
Is that okay? Okay.
Sure.
So, thanks. So basically, first of all, to say that you can run too many cycles on a PCR test is wrong. All that is important is the cycle threshold, not the number of settings it's set for. The cycle threshold here is 18. This has been set for 50. So 18 is your answer. If you set it for 60, 70, 80, 90, 100, it makes no fucking difference. The cycle threshold is 18, and that's what's important. Now, when we come to Kary-Mullis, if we have a look, I've got the patent here. Let me just close these down. I'll bring up the PCR patent. And what people don't realize is Kary-Mullis's PCR is not the PCR that was used in the COVID tests. Why can I shut these fucking windows down? Sorry. So what was used was this. Kary-Mullis's patent is this one here. And we can actually see if we scroll down, polymerase chain reaction. There we go. Kary-Mullis, if I just zoom in here, in his own patent, highlights just how useful PCR is for diagnosis. Right, so he talks here about using it for diagnosing a range of disorders, genetic disorders, cellular disorders, etc. But the clip that went out that the kind of like conspiracy theorists, anti-vaxxers are sharing amongst each other is a clip of Kary-Mullis saying you can find anything and you've got to be careful. And what he meant by that was, if something is there, you will find it. And when you've replicated it enough times, you'll have a lot of it and you've got no idea how much there was to begin with, right? Which is why quantitative PCR, which was used in the COVID test, was invented in 2001. It's a completely different system. And the quantitative PCR is what I explained here, where there is no such thing as too many cycles. So I really wanted to get that out because people think that Kary-Mullis invented the PCR and it was his version of PCR that was used in the tests. And therefore you can have too many cycles because you end up with this genetic material and you don't know how much at the beginning. And that's all bullshit. It's quantitative PCR, the number of cycles. You can run as many fucking cycles as you want. All that matters is the cycle threshold.
So well, I thank you for I thank you for explaining that more thoroughly, because I wasn't aware that it is a different PCR test because it's irrelevant to me. Because one more time, unless you're symptomatic, you're not really contagious. The World Health Organization even came out and said that asymptomatic spread is not an actual driver of any pandemic, and that's just the fucking truth. Can people be asymptomatic now if you're vaccinated? Yeah, because when you take a leaky gene therapy, actually, not even a vaccine, when you take a leaky gene therapy that suppresses symptoms instead of stopping the virus, now you can be contagious without symptoms. But normally, for anybody that's, not has a suppressive, some sort of gene therapy in them, asymptomatic spread is not a thing. So just because you test positive does not mean you're symptomatic, which also does not mean you're contagious. And all of that is irrelevant because if I'm sick with COVID, that doesn't mean I'm going to die. It means I got a cold. If a 80-year-old is sick of COVID, they're in danger. So I hear where you're coming from, but we're arguing about cases and semantics when the absolute definitive proof is that for under the age of 70, this was not a population level threat, and therefore lockdowns, masks, none of it was guaranteed. There was not even a justification for emergency use authorization of the gene therapy because, again, not a population level threat.
Okay. I just want to address the thing where you said that if you're not transmissible, if you don't, okay, fine, it's a different PCR, but it doesn't mean that you're transmissible. Let me explain how it works. Because again, that's not true. If you have a small amount of genetic material in you, then you're one or two places. You're either at the very beginning of your infection when it's starting to multiply, or you're at the end when your body is shifting it. And obviously, PCR, if it comes back and you've needed.
So there's no asymptomatic spread. There's no asymptomatic people.
Well, that wouldn't be accounted for. Like PCR test doesn't test whether you're symptomatic or not.
Right.
Yeah. So
that's my point.
I thought you were saying that the PCR test would give asymptomatic people. Would give people who weren't spreading the virus a positive test. I thought that's what you said. Are we on different?
Well, you're saying that the PCR test could be positive for somebody that's asymptomatic, right?
Oh, absolutely. Yeah.
Yeah. Well, asymptomatic, you're not going to spread the virus.
But if you are trying to find, I don't know how it worked in your country, but in our country, you took a PCR test because you fell ill, you had the symptoms, you took the lateral flow antigen.
It did not work that way in the United States. They tested fucking everybody.
What did they do?
If you wanted to walk into a hospital, they would test you.
Well, everywhere you went was PCR test.
Well, most places, yes. You would have to have a positive. You would have to have a negative test to go places. A lot of places in the United States too.
You're not talking about the lateral flow tests here.
Oh no, no! At the very beginning, people were lining up in their cars to have some stranger in a suit jam a fucking thing up their fucking noses to see if they were actually positive or not. Most moronic shit I've ever fucking heard of. You're not sick, so you get tested for a fucking cold. Ridiculous. But again, like I will concede that it might have been a different PCR test, and maybe that does mean you have the genetic code in you. I would also point out that it's the same genetic code in the coronavirus most of the time. It's about 80% similar. So it could have been just a cold instead of COVID, but also a positive test does not mean symptomatic. And even if it was positive test and you were symptomatic, nobody should be able to tell you what the fucking do. If you're afraid to go outside, stay the fuck in. If not, you choose your own risk, right? Do you think there ever going to be drunk drivers on the road when you're driving?
Of course.
Right. They're not going to catch them all, no matter what. No matter what lockdowns they do, no matter what they do, there's going to be them, right? You still drive?
But they try, don't they? They try.
Well, yeah, you can try, but we can try to keep them in. We can try to have them. Try to have them not get drunk and drive. We can absolutely try that, and they can get punished if they do drink and drive and hurt somebody or get caught, of course. But the idea is you still accept the risk, knowing that there's going to be people out there that are drinking and driving. It's not even what happens to the drunk driver. You know there's going to be drunk drivers. You know there's going to be risk, and you still choose to do so, right?
Yeah, I mean, I get it. Our division is a moral thing. To me, I would prioritize saving lives that are not, that are savable. I will prioritize that. You come from a different culture. The whole American thing of, they say, well, it's our
the average
right, your amendment.
The average age of death was over 80 here, man. The average age of death was over the age of life expectancy.
We're not arguing science here. We're arguing viewpoints and morality, as opposed.
My thing is that is the average age, and most of them had very serious comorbidities. That if that's the average age of death, it is immoral to imprison people, to lock people down, to destroy the economy, to ruin people's futures. When the average age of death is 80 years old, mostly made up of extremely sickly people. That, to me, is the immoral thing. It is immoral to sacrifice the lives, livelihoods, and thriving capability of the youth for people that have either lived their entire lifespan and are over the age of life expectancy, or people that choose to glutton themselves, drink themselves, or smoke themselves into weakness. It is immoral for us to tell people who have no problem accepting risk of going outside that they cannot go outside to try to protect other people. That is immoral to me. And so I get where you're saying. The morality of your saying is that we should do everything we can to stop one death. There is no stopping an endemic coronavirus. There's no stopping an endemic upper respiratory virus. It has, by the time they even thought about it, as I have shown, it had already been around the world at least once, because it was in literally thousands of miles apart in the United States by November. Like I get where you're coming from.
I still disagree on that one, but
how? Please tell me the other possibility of 9 states. Rhode Island is as far away from Oregon and California as you can fucking get. I mean, it is farther apart than all of Europe.
I don't understand why you believe they have somehow. It's a chain of transmission between themselves. I don't get why.
No, it's not. It's not a chain of transmission amongst them. That's ridiculous because they're far apart. I'm saying that even proves my point more. Okay, that means that it was already in all of those areas before that. They didn't give it to each other. They got it from somebody else in those areas who likely got it from somebody else in those areas. And we're not even including the other 41 states in the United States. That's where I'm saying it was. So that I'm sorry that there was apparently was a misunderstanding. I didn't mean that those 90 people that got tested out of the 7,000 people gave it to each other. They clearly got it from other people in their own areas who got it from other people in their own areas.
Okay, yeah, that's why I was so confused about what you're saying before.
Yeah.
That was a misunderstanding.
Which means at the latest early November.
Okay, so I mean, I don't want to keep treading over old ground. I would still say that obviously it started in different pockets because people have brought it into those different pockets and it's spread out in those little pockets. I still think the numbers are fairly. I think.
But how do you know they're little pockets if we didn't test the other 41 states?
Well, we're talking about the pockets on the paper, aren't we? The paper.
Right. We're talking about the pockets on the paper, but common sense and logic would dictate that if we tested other places, it would be other places,
Yeah,
especially with the geographic spread of that, especially because they didn't catch it from each other. Like, you don't think that it was spreading around Florida? Miami is the most busy. Miami and Atlanta are the two busiest airports like in the fucking world. You know, I mean, like. And New York, by the way, New York wasn't even tested. I don't believe in that paper. And New York is also 21 million people. Like, I get where you're coming from, but it was clearly to try to say it wasn't early November. You're stretching reality and math. You know,
I don't know. I mean, to me, I'll accept that. Right? That's what you believe. To me,
it's not what I believe. That's the math, man. That's just math. That's mathological deduction.
To me, the same is true with this, though, suggesting that, this curve would, when we've got a lockdown here, and a lockdown here, that it's not the lockdowns that are reducing the hospitalizations. To me, that is massively stretching reality.
So did they lock down for all those other little blips there?
This was vaccine period.
Wow. So the vaccine didn't work because it kept popping people up. I agree with that.
We won't do that here, but I would love to do we'll probably have to do it on Rumble. You will get a chance. But I talk about the gene therapy all the time because that's what it is. It's a gene therapy. But we could do that again because we'll probably be much more polarized on that. And I would love to do a vaccine one with you if you're happy to do.
Well, it wasn't a population level threat. There was no need to try a new therapy that has no testing. Like, right now, we're the experiment. Like, the population's the experiment. I'll tell you this right now. I'll say that the vaccine was good if you can produce 10 years of safety data like most vaccines needed.
Well, if you look at the way I don't want to do this debate right here.
We can do it later. I have thoroughly enjoyed this, so we can do this later.
What I will say about the vaccine, though, is it is the most tested drug in history by now, with the number of doses that have been given out. The amount of data we have on it is huge.
No, it's not. Not even nearly.
What drug has been
longevity?
Given to many people.
As many people with the experiment still running. That's not tested. That's experimenting.
I know you think
it normally takes 10 years to get any type of safety data. Not to mention that you want to check out what happens to the children, the offspring of people that have gotten this. We didn't do that. We just jumped into injecting babies. So with no safety data on injecting babies. Shit, our CDC director was telling third trimester women to get injected with it, which is insanity. They tell you not to eat deli meat when you're pregnant. But you say it's the most tested. I'm saying it's still experimental because it's still experimental. I mean, it's not even 5 years in yet. It's still experimental. For all you know, everybody, and I don't think this is going to be the case, but for all you know, at year 7, everybody that got it's going to drop dead. But you can't refute it. I don't think that's either. But you can't refute it because there's no data saying it because nobody's had it for 7 years.
What would
that's the thing? You say
over 7 years.
What would a possible heart inflammation, heart damage? It's a gene therapy which causes the body to produce spike proteins. Spike proteins are actually deadly. I don't even know why they fucking decided on having their body be taught how to make the spike protein. Now it's insane. But I get where you're coming from. You think it's tested. It's not tested. It's testing right now.
Two questions out then. So you say you say it's a gene therapy. Question 1 would be if it's a gene therapy, what human gene is it replacing, integrating with, working on? Because it doesn't. And the second question then answer would be, oh shit, I can't remember the last thing you said. just remind what you said before the question disappears. You said it was gene therapy, and then what did you say?
I don't know. You're asking somebody that has ADHD, man. It's what I say is often a surprise to me too. So
it's fucking gone.
Well, and you're wondering why it's a gene therapy. The technical definition of a gene therapy is something introduced to the body that trains the body to do something that it doesn't normally do. A vaccine is normally given with a either dead virus or semi-live virus that then incites your body to do what it normally does, and that's produce an immune response. But a gene therapy tells your body to do something completely different, and that's what this is.
Well, let's have a look what gene therapy is. Gene therapy, the introduction of a new fully functioning gene into a person or other organism in order to treat an inherited disorder or disease.
That's one definition of it. There's multiple definitions of it. And they changed the definition of what a gene therapy was in 2020, by the way.
Okay, well, if you can find, hit me up on Twitter with it. If you can find the definition of gene therapy that you give me there, I'll be honest, I don't think you can. But we can definitely, I'd be up for that, because I think we're far... Like,
you're actually going to argue it's not a gene therapy when it doesn't perform like a normal vaccine, right?
Well, no, I'm going to argue that it uses genetic material, but the definition of a gene therapy is something that is literally introducing genes into the body, or So
it's not a vaccine, or it's not a vaccine or a gene therapy then.
Of course, it's a vaccin. The idea that
how is it a vaccine? How's it a vaccine if it doesn't do what a vaccine normally does?
Right. So the idea of it not being a vaccine is as silly as me saying like an electric train or a diesel train isn't a train because it doesn't work the same way a diesel train does. What they do is they promote, they prime your body to be ready to give an immune response to the introduction of the same pathogen again. That's what they do. They have the same result. It's like saying, like a BBC Micro isn't a computer because it's not an Acorn Electron, going back in the olden days. They work differently. An electric car is a car. A diesel car is a car. They're still both cars, but they work differently. So I don't buy into that one.
Okay, so the definition of a gene therapy is a medical approach that treats or prevents disease by correcting or the underlying genetic problem, often by altering the gene code to recover the functions of critical proteins. It involves modifying a person's genes to treat or cure disease. So modification, in other words, getting your body to produce spike proteins.
No, it's not modifying genes. It's not modifying the person's genes. The genes are in the DNA. It's not modifying the person's genes.
You asked me to pull up a definition. I'm pulling up a definition.
Okay.
Gene therapy is a medical technology that aims to produce a therapeutic effect through manipulation of gene expression or through altering the biomedical properties of living cells. I mean, there's multiple, like you pulled up one definition, and my point was to you that there's multiple definitions of it, and they have changed it fairly often. The goal is to restore normal protein function, blah, blah, blah. Like, I get where you're coming from, but if we can go with one definition, or we can use all of them. And I didn't just make that up. I obviously just looked it up quickly with a quick Google search.
But none of those definitions you give me describe what the vaccine does.
But
so what? You know what I mean? None of them.
So you're saying that it doesn't tell your body to produce spike proteins?
Which definition of gene therapy? Take your time, have a look at them. Which definition of gene therapy that you've just read describes the vaccine? And I'll listen real careful to the definition you give me.
Gene therapy is a medical technology that aims to produce a therapeutic effect through the manipulation of gene expression or through altering the biological properties of living cells. So you're saying that the biological property of living cells were not altered when they were trained to produce spike proteins?
Absolutely. That's not how the
gene therapy
thing's working at all. It's not affecting gene expression. So that's the first part. And the second, the normal biological properties, the biological processes are for the ribosomes and the mRNA polymerase to translate mRNA. All you're doing is giving them mRNA that it's already primed to translate. You're not changing the processes of the cell. The cell is doing what it always does. It's just doing it on a different bit of mRNA.
The cells normally produce spike proteins.
The cells normally translate DNA, and which is the process.
So do they normally produce
mRNA?
Do they normally produce spike? Do they normally produce spike proteins? Or is that a change?
No, it's not. It's not. They produce proteins. They produce hundreds of thousands of different shapes of proteins.
Yeah, absolutely. But where they produce spike proteins,
it's a weak definition. That is a weak stretch. I'm going to have to call that out. That is a stretch to give that as a definition for the vaccine.
It's not my stretch. I literally just looked it up. You said go ahead and look it up.
Okay.
I produced three different definitions, and that didn't match yours. So maybe the three I have out. What'd you say?
All yours talked about gene expression, affecting gene expression. That is what I'm saying. That is what gene therapy does.
No. The gene expression or biological, or what I just read, or to alter biological properties, right?
So what property has been altered?
The production of spike proteins.
That's not a property. The biological property is the ability of a cell to do something, and the ability of the cell. The cell isn't producing spike proteins on its own. What the cell is doing is translating mRNA, which is what it's always done and what it always does with or without a vaccine. So there's no property of the cell. That's like me saying a computer, with the old floppy disk drive.
So you're saying that it wasn't necessary because your body produces the spike protein.
No, I'm saying it translates. So forgive me for asking this because I don't know. I know you do a lot of research and stuff. But forgive me for asking. Do you understand the process of protein synthesis? Is that something you have looked into?
I'm limited, but again, you asked me to produce definitions, and I did.
I think on this point, I think that is the stumbling block. We'll talk about it later on, but I think once
the biggest argument for it is, one more time, 0.05 infection fatality rate. That does not need a vaccine or therapy at all. And by the way, most of the elderly people that would take it, it's just as dangerous probably than the cold. So
when we do the vaccine debate, which I would like to do, I think we've been, obviously we disagree, and I think we've been well mannered and respectful in this. When we do that, I will bring you hard data to show actually that the vaccine is very safe and has saved an awful lot of lives. That is my absolute stance on that.
0.05 infection fatality rate.
Don't get me wrong.
COVID was not a threat to begin with. It didn't save that many people, bro. If it saved anybody, it didn't save that many people.
I believe in the vaccine, but
that's what
I am not ever for mandatory or compulsory vaccination. So I don't know whether it was mandatory or compulsory. It wasn't over here. Nobody was forced and held down over here.
Until there's actual long-term testing, you need belief because there's no long-term testing. So
we could do that. We can do that again. We can do this again.
Yeah, absolutely. So we'll hook up off screen. We'll pick that up. We'll do it on Rumble and everything like that. I'd love to do that, man. Thank you very much for joining me. I truly love this conversation and appreciated it. So I really wanted to thank you. If you're a follower of mine that's watching, please do follow Culture Catz. I see a lot of people are actually watching on X. So go follow him. He goes by, what do you go by on X?
Oh, just I don't use Twitter much because I'm too lazy. It's still Culture Catz, but all I do is tell people to fuck off on there, so you don't want to follow me.
Okay. But go to his YouTube and follow him there. Thank you all for tuning in. I appreciate it very, very much. I hope all of you have a phenomenal day. Tell everybody where they can find you, find your stuff, tell them what you do, advertise whatever you would need to advertise.
Channel's Culture Catz, and that's really it. I mean, I don't sell anything. I just make videos once a week where I laugh at, idiocy on the internet, and that's really it. There's not much to tell.
All right, man. Thank you very much again. It was a pleasure. Honestly, it was a pleasure. I love any opposing opinions. I absolutely love. Thank you so much. Hope all of you have a great day. My name's Alan Roberts. Have a great weekend. God damn.